My name is Lynn Gilbert, and I live in Sierra Vista, Arizona. I'm an RSS, so I provide peer support to people that have a mental illness like I do, and try to help them work out their own problems. I'm heading to work at CBIS, and usually when I get there, it's jump right in. It's really amazing to me that I'm doing peer support. I never thought I'd have anything to offer because I never thought I'd have anything for myself. I remember being so depressed, things were never going to get better. I was very helpless. You have to have something to give away to do this job. And, you know, for one thing, I've got tremendous role models at work.
Hey, Lynn, you got a minute?
All right.
My name is Robin Falquez. I was Lynn's initial case manager into the CBIS system here, the first person involved with her. Lynn had lots of difficulties. Lynn was not able to deal with the outside world.
You know, the worst depression I ever had, I was in bed for 6 months. And I didn't take showers, I didn't brush my hair, I didn't take care of my kids. You just want to die. That seems like the only way out. It seems like the only solution. I was really lucky. I ended up with Robin as a case manager. And one of the first things she got across was, you are not your diagnosis.
So 1 to 10, 1 low, 10 high, where are you?
Emotionally, I'm doing really well. I used to be pretty quickly triggered, and it doesn't seem to be like that anymore.
Okay, which I'm really, really, really happy and proud of you about. You have no idea.
Wow.
If you're looking at somebody getting better, then you need to be addressing all the issues in their lives, their health, their wellness, their medical, as well as their psyche, in order for them to get better.
So, Lori, you can see that your blood pressure is in the ballpark. My name is Julie Sharp, and I'm a physician here at CBIS Medical Clinic. I would say that most seriously mentally ill patients feel quite isolated. Their mental health problems are overwhelming for them. A lot of times, seriously mentally ill people don't see a regular primary care physician. And if I hit a spot that's particularly painful, let me know, okay? We see a lot of obesity, hypertension, poor nutrition, very poor dentition. So they have a number of issues that eventually are going to create health problems for them. Here at CBIS, it's kind of a new innovation to add a medical clinic to a behavioral health facility.
CBIS, with its plan to have all sorts of services covered, for me it was a lifesaver, because you couldn't have caught me getting brave enough to go find a family doctor or go find a gym. That would never have happened.
6.
This agency provides nutrition, exercise, social interaction, guidance, and a pharmacy on site. It's very helpful for them if we can offer services in sort of one stop. So what is her situation?
Situation is now she's currently still a client here.
The nice thing about this facility is that I have access to the behavioral health providers, and they have access to me. And what you were describing before sounded a little bit like hypervigilance.
We will collaborate. We'll discuss our treatments, our ideas, our suggestions. Lynn completed the RSS training recovery support staff. And she's employed here now.
You know, from a case management standpoint, I think the working has significantly helped
Oh,
her.
it has. It's really done wonders for her self-esteem. This is the most stable she's been since I've known her.
The providers at CBIS were amazing. They were as committed for me to be truly well as I was. Hello there. I'm just doing a check-in call. Hadn't seen you for a while, so we were just wondering, how's it going for you? At CBIS, I started this journey of recovery. All the meds are working? One of the turning points for me was when I started trying some of the skills they taught me. It's part of what gave me the courage to step out there and do peer support.
Hello, Lynn.
Oh, hi. How you doing?
I'm doing good, thank you.
Well, let's go ahead and go outside today.
Okay, that's fine.
Do something different.
Sure.
I hope I have what was given to me to give back, but I'm surprised I'm actually good at it. So far, I haven't talked to anybody I couldn't relate to, and most of the things that they talk about I've been through. I went through my druggie phase too. Most of the people I know that used, they did it because they couldn't handle ordinary life. They weren't
Yes.
happy with it.
Yes.
It had to be more.
Yeah, it was a struggle.
Right, right. My whole focus is on getting them to realize that it's not just about managing symptoms, it's about having a life that's worth having. It's funny, you know, in less than 2 months, I'm gonna be 59. You know, some people say that's the last good birthday, but I don't think so. You know, as I get older, things have gotten better and better. I've got a new career, I've got real relationships. You know, there's so much going right now. And I don't see that getting shaken up no matter what happens. You know, 59 and my life is just starting.